If you have blood in your poo, what does it actually mean? There are loads of reasons that someone might have blood in their poo, but some of the more common ones would be hemorrhoids or piles, anal fissures or tears, inflammatory bowel disease, and even anal rectal colon cancer. If we quickly run through these one by one, the hemorrhoids or piles are essentially enlarged blood vessels around the anal margin. The most common cause for them is constipation. So we need to make lifestyle changes to reduce constipation and avoid straining when on the toilet. There are creams and suppositories that can help, but if one of them becomes thrombosed, so it gets a blood clot inside it, it can cause significant pain and it's not very pleasant. The operations are fine, but there's no guarantee that they'll work. And unless you fix the lifestyle issues, there's a good chance that the hemorrhoids are just going to come back. The second was anal fissures or tears. So again, the most common cause for these is constipation. So again, we just need to deal with the lifestyle issues. You're aiming for soft, regular bowel motions. If you are constipated, it's worth thinking about reducing caffeine, reducing alcohol, increasing the amount of water that you're drinking, and increasing the amount of fiber that you're having. Things like psyllium husk can really help to improve constipation. And remember, we're aiming for soft poos that are happening regularly. So soft, regular bowel motions. The third is inflammatory bowel disease. So that includes Crohn's disease and ulcerative colitis. Now, these usually present with tummy pain, extensive bloody diarrhea, fatigue, weight loss. It is horrible. But if you suspect that you might have something like that, please see a doctor urgently. Other people may have a change in their bowel habit and passing mucus or pus from their back passage, as well as tummy cramps. The fourth would be anorectal cancers or colon cancer. Now, that can present with even a lump around your back passage. It can present with blood in your poo and a change in bowel habits. It can be difficult to differentiate between these four causes of blood in your poo, but that's why it's really important to see a doctor to make sure that we're not missing something like an IBD or a cancer. And the way we would do that is via really good focused history, doing an examination, and we would probably end up doing some investigations as well. Sorry, I've just remembered. A fifth one would be gastroenteritis, which can be caused by viruses or bacteria, but that can present in a similar way to inflammatory bowel disease. Once again, if you have any problems, go and see a doctor.